Now to some health news, maybe more accurately, a health anniversary. Yesterday marked 4 years since the World Health Organization declared COVID-19 a global pandemic. You probably remember all the uncertainty about how serious the virus was and if it was curable. Now, 4 years later, the way that we treat illnesses has changed. Telehealth is much more common. We wear masks when we're sick. There's more of a focus on mental health, and there's much more awareness about the importance of vaccines and how they work. And today we are talking with our go-to expert and reflecting back about all the advances that we've made in 4 years. Joining us live is infectious disease Dr. Thomas Russo. And Dr. Russo, I think by the time we get to this week in March every year now, we all just kind of can't believe it's been another year and maybe shudder at the memory of what it was like to live through those first couple weeks at least.
Yes, no doubt. We're doing better. We're almost on the backside of the winter respiratory virus season, fingers crossed.
And we know that there are vaccines and boosters for COVID-19 still to this day. So what should people know about getting those and when they should get them despite overall cases being down?
Well, I think it's important for people to realize that COVID is not going away. In fact, it hasn't become a seasonal virus yet. So I anticipate we're going to have ongoing cases moving forward, even through the warmer months, albeit the good news is cases are down. Unfortunately, despite the fact that we're in the best position that we've been in for the last 4 years with COVID, in this country since September, we've been averaging more than 1,000 deaths on a weekly basis. Now, albeit that these deaths have been primarily in the most vulnerable, though there's risk for all age groups, what we saw this year is hospitalizations and deaths were occurring primarily in those groups that were either not vaccinated or those that had not received the most recent updated version of the COVID vaccine. So as you mentioned, vaccines work, and I think it's critical for people to realize that it's very important for them to keep up to date with their COVID vaccination.
And you can go to any pharmacy to get one of those.
That's correct.
And another lasting effect of the lockdown is the way that it has affected people's mental health and the way that people have become more aware of their mental health and talking about it. Would you say that the pandemic helped bring more awareness to mental health?
Well, there's no question that the pandemic increased our awareness of mental health. Obviously, it was a significant problem before the pandemic. And during the pandemic, the situation got worse. Depression increased. Anxiety increased. There were significant barriers for various services, particularly early on in the pandemic. And this was due in part early on that people were isolated, but also in part financial concerns. A lot of people lost jobs or their jobs were at risk. And in addition, long COVID, we believe, is also contributing to these conditions. So despite our increased awareness, this is an ongoing problem, and it really needs to be addressed.
Yeah, and that's going to have to be addressed for years to come, something to always be aware of and check in with yourself and check in with your loved ones as well. That was infectious disease Dr. Thomas Russo. Dr. Russo, thank you so much for joining us today and always here on Channel 2.
My pleasure.